While I was driving towards in Barranca, going towards the freeway, my eyes gazed the mirror, and it's like look at my I look at my face, my one of my eyes is shut like this, and then I can open this part of my mouth here. I said, oh my God. And then I was in Barranca and San Bernardino. Turn right immediately. I know, a couple of blocks or like after Citrus, there's a hospital. This is inter-community.
Caesar, in April, came to the front lobby at the inter-community campus. And fortunately, there was a staff who recognized the signs and symptoms and activated what we call a stroke alert at the inter-community campus.
And I tried to say, help. I can't talk. And then she said, like, you're having a stroke.
He was identified as having an ischemic stroke, which is the blood clot in the artery of the brain. So we knew time was of essence. Caesar was transported to Queen of the Valley Primary Stroke Center. There he received what we call TPA.
And I got a call from a 626 number, which happened to be the receptionist at one of the hospitals over here, and she had called and she said, your father's having a stroke. He's being sent to Queen of the Valley right now. And I was just in complete shock. It was probably, honestly, one of the scariest moments of my life.
I was like panicking because my numbness, like I feel like spreading.
They let me in, and he was there lying in bed, and he couldn't talk at the time, and you could tell how frustrated he was, and you could just kind of feel the tension in the situation. It was definitely eye-opening, and it was very scary.
The main driving force for developing a stroke center here in West Covina was the fact that the next closest stroke center was quite a ways away. And so we wanted to make sure that we provided a service for our community where they could access care immediately rather than have to go to another distant facility.
A primary stroke center involves a complete interdisciplinary care. And that includes physicians, nurses, lab technicians, radiology technicians, rehabilitation specialists, pharmacists. It takes an entire team to integrate and coordinate the care in an efficient, effective way.
You can really see how much the staff believes in this program when a stroke patient comes into the hospital. As soon as a stroke patient comes in, you'll see the entire staff rally, and everybody does everything they really can to try to make sure that that patient receives the most rapid, appropriate, and best possible care, and therefore the best possible outcomes.
There are over 750,000 strokes documented each year in the United States.
It's a myth to say that stroke is not preventable. In fact, 90% of strokes are preventable. If we could control blood pressure, if we could control cholesterol, diabetes, and reduce smoking and obesity in our communities, we would essentially turn this very common disease into a very rare one.
Every 3 to 4 minutes, someone dies of a stroke. Stroke is the 4th leading cause of death in the United States.
Time is of the essence in stroke. 1.9 million brain cells are dying per minute during a stroke, so it's extremely important to get to the hospital urgently.
There are over 7 million stroke survivors, but 90% of those stroke survivors do have some level of disability because of the stroke.
Stroke is a condition that will affect every single one of us in one way or the other. 1 in 6 Americans will suffer a stroke, which means either somebody that you know or an immediate family member will suffer from this horrible condition. So it's extremely important to support programs like this to make sure that you have the perfect or best resources available to you in your community so that you can access those resources should you need them.
The support that I had from the staff was fantastic. And I mean, for my dad it was great, but for me it was absolutely needed. I don't think I would have made it through without some of the people and some of the conversations I had with the people at Citrus Valley.
Because of the Primary Stroke Center, Caesar's outcome was tremendously improved, and he's here today to tell us about it.
I do think Citrus Valley saved my dad's life.